Hi, welcome to today's video. For those of you who don't know me, my name is Neeva, and I usually make videos about what it's like to live in Germany as an American. And today I'm going to be tackling the gigantic topic of the German healthcare system and why I'm not the biggest fan of it. I know that this video is likely going to get a lot of people very frustrated with me because I think many people's opinions are going to be different than mine, and that's totally fine. If you want to comment and let me know why you disagree with me, it's totally okay. And yeah, with that said, let's just get straight into the video. So if you'd like to hear what I have to say about the German healthcare system, keep watching. I first off just want to say that I recognize I have the privilege to get medical attention if I need it, to have access to a healthcare system. I know that there are a lot of people around the world that don't have this, and I just want to be really clear in saying that I don't take this for granted. But with that all said, the reason that I've decided to make this video is because I always heard that the German healthcare system was one of the best in the world, that it was so great and so fair, and there was such good care here, and everyone was just really taken care of and looked after, and that's what I always heard, and that's what I thought when I moved here. But unfortunately, after living here for about 5 years, I've come to realize that the German healthcare system is flawed, unfair, and problematic. The reality is that the German healthcare system is a two-tiered system, essentially, and if you are publicly insured, you're not going to get the same privileges, essentially, as someone who is privately insured. And while you might be saying, yeah, but so many people are publicly insured, and it's such a fair system, and it's not a big deal, well, I'm here to tell you that that's not entirely true. In this video, I'm going to be referencing some facts that I found from articles online, so if you're curious about where I'm getting some of this information, it's either from my personal experience or it's from these articles, so I'm going to link all of those articles below for you if you want to check them out for yourself. So I want to start off by saying that I just moved to a new city. I live in a city outside of Stuttgart, and I have been desperately trying to find a doctor, like a normal Hausarzt, a normal doctor. And that has proven to be basically an impossible task. I have by this point called over 30 doctors in my city and like the 3 or 4 surrounding cities, and not a single one of them is accepting new patients. This is obviously extremely frustrating because that's a ridiculous amount of doctors to call to just hear that you can't get an appointment. So for someone that potentially has a car and can drive 30 minutes to get to a doctor, that's, I guess, fine, but I don't drive and I have to take the bus and the train everywhere. So at this point, if I want to see a doctor, I'm going to have to take the Bahn probably about 45 minutes to an hour to actually get to a doctor that will accept me. And it's really weird because apparently this is normal here. My husband works with someone who said that she's been searching for a doctor for her kids and she hasn't been able to find anyone that will accept them. So when they get sick and she needs to go to the doctor, she takes them to the emergency room. This was really shocking to me because this is what people do in the United States when they don't have access to good health care. They go to the emergency room and they wait for hours to try to get in for an appointment at the emergency room. So essentially now I still don't have a doctor in the new city that we're living, and I haven't been able to find a doctor within 45 minutes of where we live. So that's a huge issue in itself. And apparently it's a normal issue, which is just crazy to me. The next problem is if you can actually get an appointment with a doctor in Germany, you're gonna run into another problem. Making an appointment with a doctor in Germany is really hard, meaning that you're likely gonna have to wait for a really long time. I once wanted to see the gynecologist. I'm a woman, that's a thing that we really need to do regularly, and they basically told me it was gonna be 6 to 8 months before I could get an appointment. So I made the appointment because of course I have to go to the doctor. And of course, this was after calling numerous other doctors who all said they weren't accepting new patients. I drove with a bus and a train to get there, about 30 minutes. Then I get to my appointment perfectly on time. Actually, I think I was about 15 minutes early. And then I proceeded to sit in the waiting room for 3 hours. 3 hours waiting for my appointment. I just don't understand how that's possible. It's just crazy. How can you have to wait for 3 hours for an appointment? I just want to add that I have never waited for less than 30 minutes for an appointment at a doctor in Germany, and usually I wait for around 45 minutes to an hour. A couple months ago, I was at a different doctor in the waiting room waiting for my appointment, And there was a woman there sitting across from me in the waiting room who was sort of talking out loud because she was getting really frustrated. And she was asking me, how long have you been waiting here? I've been waiting here for like 2 hours and I'm getting really annoyed because I need to pick up my kids from school and now I'm going to be late to pick them up. And just going on and on about how frustrated she was that she was waiting so long for her appointment. And then finally, she just got up to leave before getting her appointment because it had been so long that she was waiting and she had other things she had to do. And she turned around and she said, you know what? It's because I'm publicly and not privately insured. I had never really thought about this until that moment, until she said this to me. I had just assumed that everyone struggled with going to the doctor and making appointments and sitting in the waiting room. But then I realized that actually that wasn't the case at all. I did a lot of research and talked to a lot of people only to find out that if you have private insurance, essentially if you pay for your insurance, you're gonna get prioritized and you're gonna get treated a lot better than if you're publicly insured. Here is a relevant quote from a research article that I found, and it says, "A current review of social disparities in outpatient and inpatient care found that persons with lower socioeconomic status are disadvantaged in their access to health care, for example, waiting times. Persons with higher socioeconomic status were more commonly treated by specialists and used preventative care more frequently." I actually then conducted a little experiment because I was curious about this, and I called at a few different doctors. Unfortunately, for privacy reasons, my husband has told me I cannot include recordings of those phone calls for you guys, but just believe me that I really did do this. I called at a bunch of different doctors, and I asked them for an appointment, and when they told me that they're not accepting new patients, I then said, I have private insurance. And then 3 out of the 5 doctors that I called said, okay, let's make an appointment. And not only did they say, okay, let's make an appointment if you have private insurance, they said we can get you in by tomorrow. I was just really shocked and taken aback by this, and I felt really, really upset and frustrated because here I was desperately trying to get a doctor's appointment and failing miserably, and all I needed to do was say, oh, I'm privately insured, and then I would be able to get an appointment like that. So I did a bunch of research about this because I was curious how this can be such a weird system. And it turns out there have actually been laws put in place to try to combat this problem. There are different laws that say things like doctors have to have 25 different publicly insured patients per week, or they have to have like a day where there's 5 hours of only publicly insured patients. Different sort of rules have been implemented to try to make sure that publicly insured people can actually get appointments at doctor's offices. And unfortunately, because of these laws, the reason that we wait so long in the waiting room is because doctors are trying to pack as many publicly insured patients as possible into one chunk of time. I think it's really important for me to say here that I'm not trying to speak badly about the doctors at all. I recognize that this is not their fault, it's the fault of the system. And the reality is that if doctors actually want to be making money, they need to be taking in privately insured patients, and they also then need to be packing in a bunch of publicly insured people all at once. Otherwise, it's not worth their time. Setting aside the problematic system, the waiting times, and all of that, I actually do have a lot of issues with the doctors in Germany as well. I have had extremely few good experiences at doctors here in Germany. And I've had a lot of experiences with doctors here. I have a handful of different medical issues, and I've been trying to find doctors that actually make it worth it for me to travel long distances to see them. Almost every time I go to the doctor in Germany, I basically just feel like I'm getting rushed and they're not really listening to anything I have to say. And I've literally had multiple different doctors basically just look at me and say, so do you want a prescription for something? Or do you want a sick note so you can get out of work? Like, they really think that I'm going to the doctor just to get a medication from them so they can just get me out of their office as fast as possible. And it's so frustrating. And I do understand that doctors are overworked and they have so many publicly insured patients that they have to see. But it just doesn't make sense to me why you would be a doctor and not be willing or not want to give your patients the time and the thought that they deserve. I mean, what's the point of going to the doctor if they're not really going to try to help you? I think that the entire situation is just really, really unfortunate because I would so appreciate to walk into a doctor's office and actually have someone care about my opinions about my health and actually try to really help me with the issues that I'm facing. And that has just basically never been the case here in Germany for me, going to the doctor. These doctors are obviously trying to make enough money, so they're pushing patients through as quickly as possible, but by doing that, they're not really dedicating enough time to each patient unless they're privately insured, and that's just not fair. It defeats the purpose of going to the doctor. Unless you're really just there to get a prescription or get a sick note so you don't have to go to work. I also want to add that my issue is not with people being privately insured. The issue is that the majority of people in Germany are publicly insured, but they are not receiving the attention and care that people with good health care deserve. I think it's really interesting that Germany gets praised so heavily for their amazing healthcare system when they're actually really far behind in comparison to other European countries. I actually found a quote that I find really telling and really interesting, and the quote says, "Although only 10% of the German population is privately insured patients received 15% of all transplanted organs and were classified with greater urgency than SHI insurance. Privately insured respondents reported longer treatment durations and more attention to the needs and questions." So there you go. It's not just me and my opinion basically just saying, this is how I feel about this. It's not just me, it's a lot of people that feel this way, to the point where there's laws put in place to try to help these issues and people basically writing huge research articles that show this is an enormous issue in Germany. So while I do really want to clarify that I know I have privilege in the fact that I can have access to healthcare if I really put effort into getting it, I think that it is really shocking that Germany is considered one of the best healthcare systems, and the reality is that the system is really flawed and problematic. I'm sure that a lot of you are going to have really big opinions about this topic and what I've had to say in this video, so go ahead and get into the comment section and let me know. Let's engage in some polite conversation. And yeah, if you did enjoy this video, please hit the like button, and yeah, comment below and let me know what you think, and I'll see all of you in the next video. Bye!